Good day. I'm Dr. Victor Hulme from Aevitas Fertility Clinic, and I would like to talk to you today about a topic that's really close to my heart, and that is the issue of diminished ovarian reserve. The reason why it's such an important topic is that in the Western world, the age of the birth of first child of women at that age is slowly increasing. And this was already in 2005. And you can see in the United Kingdom and also in the UK, the age at first birth of the woman is already approaching 30. So age-related infertility is for us at our clinic and at any fertility clinic is really the core of reproductive management. And because of that, egg freezing has become more important, and it's really the fastest growing part of the work that we do, and also the use of donor eggs. The difference between quantity and quality is however important. So quantity can be showed and can be represented by the basket, and quality, the eggs inside the basket. So the questions that we are often faced with is, are there tests that, especially, is there a blood test that a woman can do to determine her fertility even before she tries to conceive? And I would like to answer that question today. What is diminished ovarian reserve, or sometimes called poor ovarian response? And can you do something to improve your response to the medicine that we use in fertility clinics? Here you can see the effect of age on egg quality. So on the vertical bar is the chances for a live birth. On the horizontal bar, you can see as the woman gets older, the success rate of IVF will drop if she uses her own eggs, the eggs that are as old as she is, or if she uses young donor eggs, the success rate is not affected by the woman's age. So this reflects egg quality. Egg quantity, on the other hand, is represented by this graph. A poor ovarian response is a woman who made 3 or less eggs in a cycle of IVF. The normal response would be 6 to 9. Some people say 6 to 15 eggs. And the high ovarian response is when we retrieve more than 20 eggs, and that carries its own risk. The test that we use in the clinic to determine ovarian reserve is a blood test called AMH, which stands for anti-Müllerian hormone. This is a substance that's produced by the cells surrounding the eggs. And the more eggs there are, the higher this value will be. And we also use ultrasound, often done at the first visit, to look at the ovaries and to see how many small egg follicles there are. A baby girl is born with roughly 1 million eggs. And these eggs are depleted as she gets older. Certain procedures like surgery or pelvic infections or endometriosis can contribute to a faster depletion of these eggs. In fact, there's a whole list of conditions, for instance, like cigarette smoking, or if a woman receives chemotherapy for cancer, that can also decrease the number of eggs in her basket. So should I do a blood test, or my AMH is low? These are issues that we are faced with. And certainly the answer is it should not be done unless it's done in a clinic where IVF is considered. A much better predictive tool of female fertility is the age of the woman. As I said, the quality will decrease and also the quantity may decrease as she gets older. And there are models on the internet that one can download. One, for instance, is called the Hunold model, where the age of the woman, as well as how long she's been trying to conceive, semen parameter, and her previous pregnancy history is included to calculate her chances of conceiving within the next 12 months. This is what it looks like, and one can download it from, there's a Dutch site called Freya.nl, stands for Netherlands, where a woman or the doctor can download and predict the chances for spontaneous conception. So, diminished ovarian reserve is also called poor ovarian response, as I said previously. And these are the criteria. It's associated then with a woman who is older, who previously had 3 or less eggs, or if one of those tests, the antral follicle count, ultrasound, or the AMH is lower than certain values. There's also a more modern criteria that we sometimes use in the clinic called the Parseiden criteria, which is complicated, but doctors can use that. So again, just to make the point, because so many women can be upset or sometimes are upset because they did ovarian reserve tests, maybe, as I said, unnecessarily. The American Society for Reproductive clearly stated that these tests should not be used as a fertility test because they are poor predictors in a woman who is not struggling to conceive. These tests then, why do we do them? Just to re-emphasize, we do them in order to manage expectations in IVF, to manage the expectation of how many eggs will be retrieved in an IVF cycle. So what can one do? That is the third question. What can one do to improve the response to the IVF drugs? Because there is a ceiling in how a woman can respond. And also, it's very expensive to use unnecessary amounts of these drugs. Poor response, if a woman is not counseled beforehand and there is not expectations are not managed, can be associated with all the emotional distress that goes with the cancelled cycle. And of course, if there are less eggs, more cycles will be needed, as you will have a lower pregnancy rate per cycle. I often use this model in my office to show women that this ovary can only produce 3 eggs this month. So can we do something to improve this? A recent study in 2020 was published in one of the leading fertility magazines, Human Reproduction Update, where they looked at 10 different treatments and they analyzed all the literature on these different treatments to see what improved the success rate. And I just want to show you the different treatments that were considered. So HCG, also known as Ovitrol, was sometimes injected in the middle of the cycle. Coenzyme Q10, estrogen priming before the cycle started, testosterone patches or testosterone cream, the use of extra clomiphene, DHEA, letrozole, growth hormone, and LH. These were the most common treatments that we used to try and improve the number of eggs retrieved. This is, in fact, a very easy slide to read. This is a meta-analysis of all the studies that this group looked at. The vertical blue bar is the important line that must not be crossed. So if the horizontal bar touches the vertical line, it means that this specific treatment had no effect on the pregnancy rate. So they looked at clomiphene, LH, letrozole, estradiol, they all touched the blue bar. Growth hormone, very expensive to use, rarely used because of the expense, also no effect on the pregnancy rate. Testosterone in this meta-analysis had no effect because it touched the blue bar. HCG, no effect. So the only two drugs that made a difference was coenzyme Q10 and DHEA. Both of them didn't touch the blue bar, so they had a significant improvement in the pregnancy rate in this analysis of scientific studies. So how does DHEA and, in a sense, testosterone work? In women with polycystic ovaries, the level of male hormone is higher inside the ovary, and this is also associated with more eggs in the ovaries. So that's where the theory came from. Coenzyme Q10, it's important to know that there was only one study included in this scientific analysis. So small numbers of patients took part, but there was a higher pregnancy rate, and the authors said it was promising. Estrogen priming, just to show you one of the drugs that crossed the blue line, there were more eggs, but the pregnancy rate was not increased. So in summary, couples often ask, what can they do to improve their success rate? So lifestyle factors like to stop smoking and to lower their body mass index can benefit, but weight loss, both men and women, can improve the success rate of IVF treatment. AMH and antral follicle count are the best markers for ovarian reserve today. For women who have never tried to conceive, there is no place to do these tests. Rather use age or these internet models to determine the likelihood of a future pregnancy. In IVF, these tests are very important for both the patient and the clinician to manage the expectation of egg numbers that will be retrieved. And DHEA and coenzyme Q10 may be of benefit, but more studies are needed. Thank you very much.